absolute favorite part about being a surgeon is the relationships that I'm allowed to form with my patients. And plastic surgery gives me a very unique opportunity to have a very special bond with a patient that's formed quickly. And when you are doing something for someone that means this much to them, it allows you into their lives in a way that becomes very much like a friendship. And I'm able to stay in a relationship where I can give to them as they age, you know, maybe a facial procedure or a breast procedure or a tummy procedure. And it gives me a unique opportunity to meet patients, to listen to them, to find out what they want. And in the end, I feel like I'm sort of making a friend. And I don't really feel like I've succeeded unless I have a friend for life, a patient for life. What I usually hear from patients is that friends will notice that they look different, but they can't necessarily pinpoint what it is that's been done. And they just tell patients they look well rested or they look really good, and patients love that. And I think that means that they got a good result. It wasn't necessarily overdone or obvious, and yet it was a meaningful change. Usually it's exactly what they were looking for. I believe that we are uniquely positioned as plastic surgeons to offer patients the most up-to-date ideas and suggestions in both the surgical and the non-surgical realm. But my goal is to get to know them, to understand what it is that they want, and then to acquaint them with all the options that are out there. And I think patients, they expect me to, because of my expertise and my knowledge, to sort of filter through some of the marketing and some of the hype surrounded with some of the image change procedures and tell them what they really should think about, what they should invest in, and how to sort of make a game plan. Many patients will come to me and really just want to know, what should I be doing for myself at this age and then the next decade and on. And that requires a real relationship with patients and communication back and forth. I don't limit myself to just cosmetic surgery of the face or the breast or the body. I love taking care of patients really throughout their lives, and I have trained in one of the best plastic surgery training programs in the country, so I feel like I'm very well versed in all the latest technologies. I do have a strong interest in facial rejuvenation surgery, as well as non-surgical facial options. Breast implants are another area of strong interest to me, having performed lots of the clinical studies that have led to today's best breast implant, which isn't one implant right for everyone. And then also body contouring. I remain very involved in some of the new technology for the non-invasive, non-surgical options, as well as the most up-to-date body sculpting techniques. That was initially what interested me, and it continues to be one of the things that drives me evaluating my results and always looking for ways to make that better.